If you've ever had any sorts of EKG training in the past, I'm sure you've seen this picture or a variation of it in a textbook before. And though we know what these bumps and squiggles represent, how well do we actually understand why they look the way they do? Let's talk about it. It is critical for you to understand and also to remember that the true pathway of an impulse through the heart is down to the left and towards the front of the body. Anything outside of that is considered abnormal. Basically, everything must depolarize from left to right. And for this reason, lead 2, because of its positioning, is the best lead to capture this electrical activity. It is for this reason that most people use lead 2 for rhythm interpretation. It is also critical for you to understand that every time you are looking at this photo, you're looking at a cardiac event through lead 2. This cardiac cycle would look differently depending on what lead is being used. P waves, regardless of their morphology, always represent the depolarization of the atria. In a normal heart, the right atrium depolarizes towards lead 2, and for that reason, it gives you a nice upstroke and positive deflection. But the left atrium depolarizes away from lead 2, and for that reason, you get that sharp downstroke. In a normal heart, the intraventricular septum depolarizes from left to right through the intraventricular septal fascicle. Because this depolarization occurs away from lead 2, it gives you a negative deflection. The majority of the left ventricle depolarizes towards lead 2, and that will give you a positive deflection on your EKG known as the R wave. As left ventricular depolarization continues and it reaches high lateral wall of the left ventricle, this depolarization occurs away from lead 2 and it will give you a negative deflection known as the S wave. And finally, the T wave represents repolarization of the ventricles. Because this repolarization occurs away from a positive lead, it will give you a positive deflection on your EKG. Thank you so much for watching. I'll see you guys next time when I'll cover intervals, segments, and what they mean. See you later.